Hello, and welcome back to Financial Podcast. I'm your host, Olivia, here to dive into some significant developments impacting a major player in the retail pharmacy space, CVS Health. In recent news, CVS Health has announced substantial changes to its physical footprint across the United States. This involves the planned closure of hundreds of stores in 2025. According to various reports drawing on the company's annual report filed in February, CVS plans to close 271 retail locations. Some sources specify the number as 270 stores. So, depending on the specific report, the number cited is either 270 or 271. This move is part of what CVS describes as an enterprise-wide restructuring plan intended to streamline and simplify the organization and adapt to evolving consumer needs. It's important to note that this isn't an isolated event. It follows a larger trend of store closures by the company in recent years. Between 2022 and 2024, CVS closed a significant number of locations, estimated to be around 900 stores. This indicates that the closures planned for 2025 are the latest phase of a multi-year strategy that was initially announced more than 3 years ago in November 2021. The company has been evaluating changes in population, consumer buying patterns, and future health needs to ensure it has the right kinds of stores in the right locations for consumers and the business. So, the key question is, why are so many stores being shut down? CVS has provided several reasons for these strategic decisions. A spokesperson for CVS explained that the closures are based on multiple factors. These factors include population shifts, consumer buying patterns, store and pharmacy density, pharmacy care access, and community health needs. One major contributing factor highlighted in the reports is the significant alteration in consumer behavior. Many people now prefer digital solutions for their healthcare and retail needs. This includes buying items for home delivery, using telemedicine services, and filling prescriptions online. This shift towards digital engagement has resulted in a continuous reduction in foot traffic in physical stores. CVS is adapting its approach to accommodate this trend. Another reason cited for the closures is that many CVS outlets are spaced too close to one another. This high store density can lead to internal competition and lower profit margins. By eliminating this redundancy, CVS aims to concentrate its efforts on fewer, more powerful stores. The company seeks to optimize its existing stores and pharmacies, which will enable it to better meet customers' needs. Furthermore, CVS is undergoing a transformation from being primarily a conventional retail chain to becoming a more health-focused provider. As part of this vision, it intends to introduce smaller format locations that prioritize essential healthcare services. These sites will focus on healthcare, wellness initiatives, and support for chronic diseases rather than focusing on general retail items. Therefore, CVS aims to shut down locations that are considered out of date and no longer align with this evolving strategic vision. CVS has emphasized that these changes are not a reaction to industry pressures. Instead, they are part of a planned strategic initiative aimed at improving service quality throughout the remaining sites by streamlining operations. The company's focus is on ensuring they have the right types of stores and the appropriate number of stores situated in the correct locations to better meet consumers' health, wellness, and pharmacy care needs. While the company has announced the number of closures, it has not released a full official nationwide list of all locations set to close in 2025. However, through information compiled from consumer websites and local news sources, a partial list of confirmed or announced closures has emerged. This partial list includes locations across several states in the District of Columbia. For instance, in Alabama, stores at 2901 Morgan Road in Bessemer and 3303 Claremont Avenue in Birmingham are on the list. California is seeing closures at 499 Haight Street in San Francisco and 1701 K Street in Sacramento. Florida has multiple locations impacted, including 3090 South Monroe Street in Tallahassee, 13300 East Colonial Drive in Orlando, and 2201 Edgewater Drive in Orlando. Other states with listed closures include Georgia, 439 Highland Boulevard, Atlanta, Illinois, 8639 South Cicero Avenue, Chicago, 401 West Armitage Avenue, Chicago, and 2000 Skokie Valley Road, Highland Park. Iowa locations at 2420 Lincoln Way in Ames and 215 Euclid Avenue in Des Moines are also on the list. Massachusetts is listed with 55 Summer Street in Boston. Michigan has closures at 28774 Gratishit Avenue in Roseville and 27700 Harper Avenue in St. Clair Shores. Missouri has locations at 2435 Independence Avenue in Kansas City, 9433 Manchester Road in St. Louis, and 4531 Troost Avenue in Kansas City identified for closure. New York has several locations listed: 955 Payne Avenue in North Tonawanda, 153 Central Avenue, and 1026 Madison Avenue in Albany, 1241 Lexington Avenue in New York, and 1654 Richmond Avenue in Staten Island. North Carolina has a location at 201 West 4th Street in Winston-Salem. Ohio is listed with 10825 Kinsman Road in Cleveland. Pennsylvania has a closure at 125 East Main Street in Plymouth. Virginia includes 10390 Willard Way in Fairfax. Washington, D.C. has multiple locations on the list: 1117 10th Street NW, 1100 4th Street SW, 4000 Massachusetts Avenue NW, 1515 New York Avenue NE, 4500 Wisconsin Avenue NW, and 7828 Georgia Avenue NW. Additional locations reported include Indiana at 95500 Allisonville Road in Indianapolis. Maryland lists 1000 South Charles Street in Baltimore, 7235 Wisconsin Avenue in Bethesda, and 34N Cannon Avenue in Hagerstown. The Hagerstown location was reported to be closing on June 26th. Texas has a listed closure at 3890 Phelan Boulevard in Beaumont. It's worth reiterating that this is not the complete list of all 270 or 271 closures, but rather locations that have been identified through external sources. The store shutdowns will undoubtedly affect many areas. Concerns have been raised, particularly in communities with limited healthcare access, where some residents might need to travel farther to reach a CVS location. This can pose difficulties, especially for elderly individuals or those who lack reliable transportation. This highlights the potential impact on access to pharmacy care and community health needs, factors that CVS states it considered in its closure decisions. Despite these closures, CVS aims to address potential gaps in service. The company guarantees that even after this period of realignment work, a significant majority of people in the U.S., specifically 85%, will still live within 10 miles of a CVS pharmacy. This figure is often cited by the company to reassure customers about continued access. To help bridge the gaps created by the closures, CVS is also expanding its services through digital platforms. This online strategy aims to make healthcare services more accessible. Customers can utilize the mobile app and website for various needs, such as ordering home deliveries, filling prescriptions online, scheduling consultations with doctors, accessing digital medical records, and even chatting online with pharmacists. By enhancing these digital offerings, CVS hopes to better meet the needs of modern consumers. In addition to expanding its digital presence, CVS is also increasing physical access in other ways. Despite the closures, the company confirmed it plans to open new pharmacy locations in 2025. While the total number of new openings is smaller than the number of closures, they intend to open around 30 new locations. This includes adding pharmacy services within some Target stores, maintaining a widespread presence. These new locations within Target are seen as a way to consolidate locations while making them more accessible. The pivot towards a more healthcare-focused model is a significant part of CVS's strategy. The company is investing in what it calls health hubs. These are fresh retail designs that will focus on healthcare services rather than just traditional retail items. Health hubs are described as smaller locations that prioritize services like therapy for chronic illnesses, mental health assistance, and wellness screenings. The objective behind these hubs is to address the increasing demand for nearby, convenient healthcare services. These sites will give healthcare, wellness initiatives, and chronic disease support top priority. This move signifies CVS's aim to become a modern healthcare provider, moving beyond the traditional retail pharmacy model. The strategic realignment is designed to make sure patients receive quicker, more intelligent, and more tailored care, whether they access it online or in person. The company believes that by focusing assets on digital and healthcare expansion, it can stay at the forefront of the field and remain relevant as medicine goes beyond physical areas. The process of these significant changes also impacts CVS employees. The company promises to support workers affected by the shutdowns. This support may include assistance in finding new positions within the company or facilitating transfers to other locations. The firm aims to manage this period of change with integrity and professionalism. A unique and striking situation arises in Arkansas, where a new state law poses a potential threat to CVS's presence in the entire state. A law recently signed by Arkansas Governor Sarah Huckabee Sanders seeks to prevent pharmacy benefit managers, often referred to as PBMs, from owning pharmacies. CVS owns Caremark, which is noted as one of the largest PBMs in the U.S. CVS has expressed concerns that this legislation could potentially impact its 23 locations currently operating in Arkansas. The company has warned that the law might force its complete exit from the state, which would disrupt services for thousands of residents. According to one report, a resident in Little Rock noted that if their local branch closed, they would face a significant travel time, making it impractical for collecting medication. CVS also contends that such laws could reduce competition within the state and potentially lead to increased prescription drug costs. This specific scenario in Arkansas highlights the complex interplay between regulatory changes, business models like owning a PBM, and the accessibility of pharmacy services for communities. Overall, the decision to close a substantial number of stores in 2025 is presented as a calculated move within CVS's broader strategy to restructure their retail network and adapt to the evolving landscape of consumer behavior and healthcare needs. While the shutdown of hundreds of pharmacies might seem alarming, it is part of a well-designed transformation. This transformation is a reaction to changing consumer demands and the expansion of the digital economy. CVS is actively adjusting its approach by focusing on reduced but potentially more impactful healthcare centers and enhancing its digital solutions. The emphasis is clearly shifting from just selling retail items to providing better healthcare services. Although some communities are expected to feel the effects of these closures, the company's stated general objective is to create a more intelligent and effective healthcare system for the future. The company is looking to consolidate locations where they are too dense and invest in places that align with their future vision as healthcare providers. The closures are based on careful assessment of factors like population shifts, customer buying habits, the existing concentration of stores and pharmacies, the availability of pharmacy care, and the specific health needs of communities. This suggests a data-driven approach to reshaping their physical presence. The companies are ensuring that the vast majority of the population will still be within a reasonable distance of a store is a key message they are conveying to manage concerns about access. Alongside this, the push towards digital accessibility and integrating pharmacy services into other retail environments like Target stores demonstrates a multifaceted strategy to maintain and evolve how customers interact with CVS for their health and wellness needs. The Health Hub model represents a tangible example of their shift in focus. By prioritizing clinical services and wellness support within these locations, CVS is aiming to become a go-to destination not just for prescriptions and over-the-counter goods, but for more integrated health support. This aligns with broader trends in the healthcare industry, where providers are looking for more convenient and accessible ways to deliver care. The closure process itself involves several steps that impacted communities and customers might need to navigate. Although a full list isn't public, individuals can proactively check the CVS store locator for updates, contact their local branch directly to inquire about its status, and monitor local news and council notices for specific developments. Reports suggest that staff at some locations have already been informed, meaning local pharmacists might be able to provide early confirmation regarding planned closures. For customers whose stores are closing, CVS is offering alternatives. Setting up online prescription access through their website is recommended. Customers can also speak to their pharmacist about options like home delivery or transferring prescriptions to a nearby alternative CVS location. Utilizing the CVS pharmacies located inside Target stores is another avenue for continued care that the company is expanding. This period of realignment by CVS is described as a bold move for the future of healthcare retail. It reflects a company adapting to changing times, shifting from a traditional drugstore model to one that is more integrated with healthcare services and digital technology. The aim is to create a system that is quicker, more intelligent, and better tailored to individual needs, whether those needs are met through a physical visit or a digital interaction. The company's previous closures between 2022 and 2024, totaling around 900 locations, set the stage for the 2025 closures. This indicates a consistent, multi-year strategy rather than a sudden reaction to market conditions. The plan was initially announced in November 2021, highlighting its long-term nature. The strategic review that led to these closures assessed underperforming locations alongside the other factors like population changes, consumer buying patterns, and density. The goal is to streamline and simplify the organization, improve efficiency, and reduce costs, while also optimizing the existing store footprint and improving customer service delivery. It's clear that CVS is not just closing stores, it's actively reshaping its business model. The focus is increasingly on providing healthcare services beyond just dispensing prescriptions and selling retail products. This involves a significant investment in health hubs and a robust expansion of digital health tools. The combination of strategic store closures, a push towards digital services, and the development of health-focused locations is designed to position CVS for long-term expansion and relevance in the evolving healthcare landscape. While the closures may cause some disruption for customers and employees, the company maintains that these actions are necessary steps in its transformation. The commitment to supporting impacted employees and maintaining access for the vast majority of Americans are key components of their communication surrounding these changes. The situation in Arkansas serves as a compelling example of external factors influencing the pace and scope of CVS's adjustments. The law targeting PBM ownership of pharmacies directly challenges CVS's integrated business model, where its pharmacy segment is tied to its PBM caremark. This highlights the potential regulatory risks faced by large healthcare companies operating across multiple segments. Ultimately, the closures in 2025 are part of a significant transformation for CVS Health. It's a strategic move driven by a desire to optimize operations, adapt to digital trends, and deepen its role as a healthcare provider. As the company shifts its focus and reshapes its presence, customers and communities will need to adjust, leveraging the expanding digital options and the remaining or new physical locations for their health and wellness needs. This period marks a pivotal moment in the company's history as it navigates the complexities of the modern retail and healthcare environment. Thank you for tuning in to Financial Podcast. I hope this deep dive into CVS's strategic changes has been informative. Be sure to subscribe so you don't miss future episodes where we break down the financial news shaping our world. Until next time, I'm Olivia, and this has been Financial Podcast.